so I'm going to start with cranial nerve number 1, which is olfactory. And I would have like peanut butter or a stick of like peppermint gum. I don't know what his deal is. And I am just going to have the patient close their eyes, put one finger on one nostril, have them smell the item, and then do the same with the other nostril. Can you smell the item? Okay, I would ask them if they can smell that. Cranial nerve number 2, which is optic. So I'm going to be testing, can you see what number I'm holding up? 2. Okay, and then I'm going to test for peripheral vision. I'm going to ask them when they can see it. Can you see it? Okay. So cranial nerve number 3, which is ocular motor. So I'm going to do this test together with ocular motor, cranial nerve number 3, cranial nerve number 4, trochlear, and number 6 is abducens, and this is testing eye movement. So what I'm going to do is I'm going to slowly move my finger and ask the patient if they can follow, and I'm going to be looking at their pupils. So I'm going to just go up and down and back and out and then up and down and back and out. Good. And I'm going to be looking for their pupils to see if anything crazy happens. So next I'm also going to do ocular motor, and I'm going to be testing for pupil dilation, and I would use like a pen light, but I don't have a pen light. So I'm just going to act like I'm doing it. So I would close one eye, and then I would slowly, and then I would look at their pupil, and then I would do that to the other side, and just look and to see if they react to the light. Next is cranial nerve number 5, which is trigeminal. So this is face sensation. So I'm going to test their up here, kind of by their cheeks, and then down by their jaw. And then ask if that feels the same on both sides. Next is number 7, and it's facial. So what I'm going to have the patient do, I'm going to ask them to smile. I'm going to ask them to wrinkle their forehead. And then I'm going to ask them to puff out their cheeks. Yeah, good. Next is number 8, which is vestibular. Yes. Wow. And what I'm going to do is I'm going to kind of rub my fingers and just ask when they can hear it.
I can hear it. I can hear it.
And that's both sides. And then also with cranial nerve number 8 is the balance test. So what I'm going to have them do is the Romberg test. And I'm going to have them put one foot in front of the other, close their eyes, and then just try to balance. And I'm going to make sure that I'm right by them so they don't fall, and just do this for like a few seconds and to see if they're balanced. Okay, good.
Yay.
Next is number 9, which is glossopharyngeal. Wow. So I would use a tongue depressor. I would ask the patient to stick out their tongue, and then I would put the tongue depressor at the back of their throat, and yes, just see how they react. But I don't have tongue depressor. So next is number 10, which is vagus. And for this one, what I'm going to have them do, okay, we're going to move on to 11 because I need to think about, yes. So 11 is the spinal accessory, and I would just have the patient lift their shoulders and just test that, and then rotate their face. Okay. Okay, number 10, vagus. So what I would have them do is I would have them just say ah. Ah. Yes. And then cranial nerve number 12, I'm going to have them stick out, which is hypoglossopharyngeal. Yeah. 12, I'm going to have them stick out their tongue, and then move it up and down, and then side to side. Just checking to see if they have any weird tongue movements.